February is American Heart Month.
Yeah, this morning we're learning how your daily practices could be affecting your heart in ways that you probably don't even guess. This includes oral care, and joining us to talk about the correlation is dentist with UT Health Houston School of Dentistry, June Sadowski. Good morning, Dr. Sadowski.
Good morning.
So everybody's going to hear this and think, oh yeah, right. Like how could brushing my teeth have anything to do with your heart health? Tell me, how are the two connected?
Well, the bacteria that's in your mouth, if you have periodontal disease, gum disease, is the bacteria that they have found in arterial plaques.
Oh.
It's inflammation in your mouth, the bleeding gums, the not going to the dentist. And that is basically what is dangerous to the heart.
Yeah, so tell us some of the symptoms of gum disease.
Well, it's a pretty silent disease. It means that the plaque builds up around your teeth, the little fuzzy coat builds up around your teeth, and that contains the bacteria. The gums try to take it away, and that causes the gums to bleed and get sort of puffy. And if you floss, you can get that plaque out, and you can make gum disease less apparent. If you don't go for a while, you need to go every 6 months because it builds up every day.
Yeah. So your poor gums are trying to protect you from this, but it's just the bacteria is just gonna keep eroding away at your gums and eventually could hurt you and could lead to heart disease in this case that we're talking about.
The bone hates that inflammation up there where the gums are bleeding, and the bone just goes away.
So what can you do to treat that?
You treat it by going to the dentist and by performing daily oral care. It's a completely curable disease. Gum disease is completely curable.
Yeah, with just regular hygiene that your dentist, that everybody tells you to do every day. I mean, talk about some of those daily practices to make sure that our teeth are healthy.
We all want to brush at least twice a day, and that doesn't mean just brush. That means removing the plaque. Your dentist will show you how. They have they can put color on your teeth to see where the plaque remains and teach you how to brush it all off. And every 6 months they say, oh, you're doing great over here, but you need a little work over here. So the dentist and the hygienist are your best friends. And that is the most cost-effective care ever, prevention.
Remember those things growing up, Haley? Did you have those? And June, I don't know, where you would chew on those little tablets, it would have like a red dye in them,
where you didn't
and then you could see all the places where you didn't brush. So when my kids were brushing, I'm like, where are those? They're not as easy to find.
Well, your dentist or hygienist can give you some. They now come in a little Q-tip, and it's liquid, and you just brush it very carefully, and it doesn't get everywhere. It's really a good thing.
Yeah, they made it better, is what they did. So we got to ask about those. Yeah, but you know what? Dentistry, going to the dentist is so expensive for most people. So what does UT Health do? Can you remember any days that you guys might have coming up where people can come in and get a less expensive dental treatment?
Yes, we have Give Kids a Smile because prevention starts off early, and so we encourage. There's the school systems that we work with, and we would be willing to, to work with more to help them understand the prevention aspect, because prevention is really what the whole idea is.
Yeah,
you won't need to have a lot of dental treatment if you prevent it early.
Right.
All right, Dr. Sadowski, those are great things to mention. I'm so glad that you were able to bring that up because, like I said, for a lot of people, they don't want to go to the dentist because it could be something that's unaffordable. So thank you.
I want to address that because prevention is cost effective. It really is.
Yeah.
Yeah, because in the long term, you could be paying more for more damage being done.
Exactly.
So
the more you go, the more the dentist tells you to come, the better your oral health will be.
Excellent. Thank you so much for joining us this morning. We appreciate it.
All right. Thank you.